Denver Health is once again warning city leaders that skyrocketing costs could lead them to cut some services unless Denver gives the hospital more funding. This week, Denver Health CEO Donna Lynne told City Council that the hospital system is on track to provide more than $155 million in uncompensated care. That is care to people who do not have insurance. That yearly total includes $37 million in care to people coming from counties outside Denver. Lynn says those numbers have risen drastically since the pandemic, but the amount of money the hospital gets from the city to cover that uncompensated care stayed flat, about $38 million a year. As the gap continues to grow, the hospital says it's getting tougher about letting out-of-towners in there for non-emergencies.
We've taken a little tougher stand when it comes to non-emergency care for people that don't live in the city. We are now requiring driver's licenses as well as proof of something that's current, like a utility bill.
The hospital also says some of their contract services with the city, like doing medical care in the jails, that is at risk of being reduced or cut if they don't get additional funding. This all comes as Denver Health is asking voters to approve an additional 0.34% sales tax increase that would raise about $70 million a year to cover some of the hospital's operational costs. You may recall when Donald Trump came to campaign in Colorado last week, he falsely claimed that people could not get a bed at Denver Health because the hospital was overwhelmed by migrants. We have no evidence that that is true. Denver Health says new immigrants made up less than 2% of its patient visits last year.